Hello, good morning, good afternoon, or possibly good evening. Welcome to this presentation. My name is Craig Gurney, and I'm delighted to be able to record this presentation ahead of the conference on Scottish housing policies after COVID. So thanks very much for the invitation. You won't be having a video accompanying me presenting these slides, but you have got this rather large pictures here just to kind of sate your curiosity. Okay, so here's an overview of what I want to talk about today. I was asked to reflect upon the way in which the meaning of home may change as a result of the COVID-19 pandemic and the social distancing measures. So that's what I'm doing. So I want to start off by reflecting about ideas of home and what the literature tells us about that. I want to look at the most recent evidence concerning the COVID-19 lockdown measures and what that tells us in relation to the meaning of home. This is focusing specifically on Scottish housing context, so I'm going to engage with some contemporary and forward-thinking policy context there, and then conclude with some remarks about challenges for policy and for research. So let's just start off talking about home. It's one of these concepts, isn't it, that it's everywhere and nowhere, and everyone's got an opinion of it, and it's the thing that I've been thinking about for most of my career, and I suddenly feel as if everyone's interested in my thing, which is lovely. It's good to have people to talk to. Of course, one of the things about the home is its ordinariness, its everydayness. And it's often been said that one of the things about home is its banality, that we feel complacent about it. Peter King made this observation a decade or so ago. We only think about home when something's going wrong. It's there in the background and we're very complacent about it. And one of the things that's happened in 2020 is that we've been forced to think about home in ways we haven't done before, because things have, by any definition, gone wrong. So I think we can assume that the meaning of home has changed as a result of the experience of the COVID-19 lockdown measures. It has for me, and I'm sure it has for you individually. But more broadly, but how and with what housing policy consequences of these changes occurred for Scotland. I just want to start off this slide here with a rather Churchillian quote down the bottom there. This is from Adone et al. Never before in the history of academic publishing has such great a volume of research focused on a single topic. So I was on Scopus this morning looking to see just how many papers have been published. And I've made it was nearly 71,000. By the time you're listening to this presentation, let's say it's 71,000. 71,000 papers published about COVID-19 up to St Andrew's Day. That includes 51,000 papers in medicine and 7,462 in the social sciences. Now, the good thing is, from your point of view, is I've read all these, so you don't have to. So I haven't really read them. I've read quite a few of them, though. And what does that investigation into the evidence base allow me to say? Well, it allows me to say the following. In asking the question of what have we learned in the social sciences in particular, and of relevance for housing policy, what have we learned in these numerous papers that have been published this year? Do you know what? Actually, we could have predicted most of the outcomes. I'm not at all trying to say "told you so," although having said that, the quote in front of you does suggest that I'm not the only person who said back in March and April that actually the way in which people experience the harms and the hardships of the COVID-19 lockdown will not be equal. They'll be variable based upon pre-existing inequalities. And I make this point here, that any disappointments in home will not be evenly experienced. Okay, so people with housing insecurity, economic precarity, and so on, will experience the uncertainties of a global pandemic in a very different way to those people who have experienced the lockdown in a decent home with a garden, with more rooms than people living there, with decent internet access in a mutually respectful and nourishing relationship, whilst experiencing good physical health and well-being. So there's a term that's used elsewhere, which we'll talk about later on. What COVID has done is amplified pre-existing housing inequalities, and the way in which people have experienced home and have thought about home is a product of that. So what have we learned? I've got 4 general slides I want to share with you now about that come from the literature, and then 2 very specific, or 3 very specific housing slides. Firstly, I think one of the things that comes out of the literature that's been published in the last few months is as we'd expected, the foregrounding of loneliness, well-being and mental health in accounts of how people have coped in relation to the lockdown. So there's these papers here, Brooks et al., Lee, Ibrahim et al., report feelings of grief, confusion, anxiety-induced insomnia, emotional exhaustion and suicidal ideation. And that, as I said, this isn't to be, it's not unexpected, because we've seen this in previous studies. Aid Kearns, as part of his research on the Go Well project in Glasgow, has pointed out that loneliness is strongly associated with decline in mental health and cardiovascular outcomes. And this quote, I love this quote. I use this quote in my teaching all the time. The heightened risk for mortality from a lack of social relationships is greater than that from obesity. Just think about that, incredible stuff. And there's a Scottish dimension to that, because in Scotland, the proportion of single person households is 35%. That's considerably higher than the UK mean, and considerably higher than the figures in London, say. So that's interesting in terms of pre-existing ideas around loneliness and social isolation, which were already well established before that fateful week in late March 2020. Intimate partner violence, domestic violence and coercive control. It was to be expected that this was going to be an issue. Commentators suggested that confinement and exposure, stress in lockdown will mimic coercive control. There's a loss of support, and that the risks of harm would be amplified as a result. So we see this in research reported recently by Fraser, Tan, and Picaro. This study here by Women's Aid 20 published this year in 2020. 61% of abuse victims in their research reported that violence or abuse got worse during the lockdown. 55% felt more afraid, and 68% felt they had no one to turn to for help. There's an errant 68% in there. What's interesting, actually, is the paper by Aguero. I want to shout Aguero, the Aguero paper cites incredibly similar data, actually. It's kind of 65, 66% in a piece of research in Chile. Das et al., I think, is in India. Every Palmer is in New Zealand, and so on. We've got lots of international research here saying exactly the same thing, that as we'd expected, the experience of intimate partner violence, domestic violence and coercive control increased dramatically during the lockdown. The other thing I want to talk about here is the risks within home during the lockdown of unintentional injury, what previously was called accidents, hazards, and how that's linked to household type. During lockdown, people were exposed to harm within the dwelling for a longer period of time. We know that hazards are linked to tenure. So in Scotland, 57% of housing in the private rented sector is below Scottish Housing Quality Standard, and it's also related to the age of stock. We know that poor housing is associated with increased risk of depressive symptoms during lockdown, and we know from the work by Kenway and Holden quite early on in the lockdown, looking at their regression analyses, that multi-generational households, that is households where pensioners and working age people live together, especially in areas of high deprivation, were very strong predictors of COVID-19 incidence. There's a lot of text on this slide. I'm not going to read any more out. You can read it yourself, but The quote there by Ahmed demonstrates that clear relationship between a decline in housing quality and an increase in mortality or morbidity. And also you've got this issue about, within Scotland in particular, about unintentional injury occurring within the home. And finally here, health harming behaviours, kind of linked to the previous slide. You know, one of the things that we often cherish in relation to home is ideas of comfort and relaxation. The antithesis in many ways, physical exertion. Now, I've been hearing lots of things about how people have been going out for brisk walks and doing lots of workouts. I saw on Twitter the other day that Alex Marsh is very proud about how much weight he's lost. Well, I haven't. I've piled the weight on. I've been incredibly sedentary and not left the house much at all. And I think I'm, you know, not all of us can be like Alex Marsh. Many of us sadly are like me. So that's important, I think, in relation to Scotland in particular, when we think about increased levels of alcohol consumption and obesity rates and things like that, because we know, notwithstanding the minimum unit alcohol pricing in Scotland, which has had some success in the last few months, actually, that data has been reported. The alcohol-specific death rates in Scotland are significantly higher than that in the rest of the UK. And we see here on this chart this shift towards consumption at home rather than off sale. So this is something that we're doing at home. I promised you two specific bits of housing research which have caught my eye. The first one is by Phil Brown and colleagues. Research focused on the north of England. I think it's significant that it's focused on the north of England and not, say, the home counties of England or London, where the housing stock is more likely to be more similar to parts of Scotland, and certainly the climate, which is increasingly going to be an issue during the second and third spikes of COVID-19 are more similar. The consequences of COVID-19 for Brown et al. Amplified pre-existing housing and health qualities, to the extent that disrepair, thermal comfort, reductions in mental and physical outcomes were all linked to housing conditions, tensions in renegotiating home workspaces, a lack of access to outdoor space. None of these things were experienced equally. They tended to amplify and reinforce the pre-existing housing inequalities. The Brown et al. Report was published in early November, I think, late October perhaps. This report by Horn et al. Was published a week ago, so I'm speaking to you. I'm recording this on St Andrew's Day. This was published about a week ago. This comes from Uhuri, so it's an Australian piece of research, but I wanted to share it with you because I think the findings broadly correspond with the Brown et al. Findings, but what they've got that Brown et al. Haven't got, with all due respect to the Brown study, which I think is excellent, is this fantastic diagram. And I think this really encapsulates their findings very well. I'm very impressed with this. So at the heart of this, you've got ideas about resilience or vulnerability. So it's capturing agency there. You've got exposure, capability to respond, and sensitivity. And on the left-hand side, you've got the COVID virus there. You've got the policy responses, and then on the other side, you've got the physical quality. So yeah, I mean, it's just fantastic. I wish I'd thought of that diagram. Really clever. A few quotes on this. Again, it's kind of what we'd expect. People living in lower density detached housing with income security, online social networks, and the use of a car were at some advantage overall. Hobbies such as gardening took off. On the other hand, for those in poorer quality, poorly situated, lower density dwellings with few local services, the lived experience of low-rise was more about spending additional time in cold, uninsulated or poorly heated homes, or needing to use public transport to access essential work, alongside well-founded anxieties about contamination. They go on to talk about housing providing a hub for control measures, but it's not organised in such a way that it can necessarily provide that protection. And also in terms of internalising this, in terms of people's capability and sensitivity, this quote, I think, is quite telling. Most participants put the onus on themselves as individuals to keep warm or cold, and even resorted to income deprivation to keep the bills down. And I suspect we'll be seeing that in parts of Scotland at the moment. Here she is. She's the poster girl for the Scottish Government's Programme for Government 2021. The Scottish context, then, I just want to talk about a few things here. The programme for government, I mean, I'm sure there's people on this call who are much better placed to comment on this than I am, but I think two key things that stood out for me in relation to thinking about home and how home might change, and we may think about homes differently in the coming years, is that we've got a commitment from the Scottish Government to shift 50,000 more people into the digital world and to provide 50,000 more affordable homes. The capital spending review and the draft infrastructure investment plan are going to kind of deal with together. We've got 33.5 billion promised in the capital spending review. 24 billion of that is earmarked already for things like resilient and sustainable places, for high quality infrastructure, for energy and efficient homes. And these are all things, I think, which are more important now than ever before, given the findings we've just heard from Brown and Horn et al. Housing to 2040, well, there's kind of the very bold 15 key principles in there. No one's going to disagree with any of those. They're certainly very radical. They're certainly all-encompassing. That's my understanding, and that the consultation hasn't been reported on yet, but I'd hope that when that consultation is reported on, that some of the careful thinking that's gone into the capital spending review and the draft infrastructure investment plan, which is COVID proof or COVID ready, is used in the same way. So in other words, that those 15 principles, I think, can still go ahead, but I think we need to think about what they now might look like with the benefit of a bit of COVID hindsight. The other important context, I think, is the recent report published by Cash, by Gareth James and Tolson, about delivering more homes and better places, looking at the work of the Scottish Land Commission. And I think what's really important there is thinking about land assembly and the way in which successful places might be created. And this idea of the 20-minute neighbourhood, which seems to be everywhere at the moment. And I think that's important, I think, to reflect upon, given the importance of outside spaces during lockdown. So just to finish, and just to kind of conclude really with some observations about home and how it might have changed. I think the properties of home will have changed for people. I think we've got changing experiences and expectations of home, which are going to work their way through the housing system in terms of individual consumers' demand and of course supply to meet that. It's going to have an impact upon the way in which tenants in all sectors have changing expectations about what their homes offer them. So there will be an effect upon housing markets. I think there'll be changing space requirements, particularly for those who are able to work from home, a demand for more flexible spaces. I've seen that very strikingly, I think, actually, in looking at properties currently for sale and for rents on Zoopla and Rightmove and other online fora, where the spare rooms are dressed not as spare rooms, but as office spaces now. They're dressed with desks. I've been thinking a lot about gentrification recently for another project, and I'm kind of wondering whether because of this we don't need to be cheek by jowl with work anymore. It's one of the great things about gentrification, that one of the kind of drivers of that was that people who could afford it to were moving to inner city areas, displacing poorer people, and one of the kind of the drivers for that was the proximity to the workplace. But of course, for those of us who can work at home, we don't need to be close to work anymore. So I wonder whether the blue and green spaces, the places with visual amenity in Scotland, might see a gentrification. Might we see a displacement of pre-existing communities in coastal and highland communities where housing might become dramatically much more expensive as a result of the kind of shift in demands? That's something to think about. I'm not a housing economist, clearly, but I think that's something that I think might happen. Linked to that, of course, is a general deurbanisation, and I think that runs counter to one of the things that's at the heart of the programme for government, which is about vibrant town centres. So I think deurbanisation is a threat to that. And I think that working from home, the ability, the capacity to work from home or not, creates a new dimension of housing inequality, which will fundamentally change the way in which we think about what home means and what home does. And of course, linked to that, of course, is the importance of digital connectivity. I think it goes without saying that when we think about home in future, that it's important that we make these connections between housing and health. We know about housing's role in perpetuating the social gradient in health, but where is the causation? I'd ask the question, why is it that housing and health policy making remains so separate and so siloed, given that the history of state intervention in housing is, of course, the history of public health? I think it's important that we do, as either academics or as policymakers or as commentators or as people who live in dwellings that we call homes, think about our homes in different ways. And I think that idea about thinking about home differently is beautifully captured in this quote by the editors of the International Journal of Housing Policy in their editorial that was published in the last couple of weeks. They say, developing a clearer view of the impacts of the pandemic on housing markets and systems will be a long-term project for housing scholars. Already visible, however, are the ways in which COVID-19 exacerbates existing housing inequalities and the many different locally instantiated manifestations of COVID-induced housing change. And I refer back to my point about kind of COVID-induced gentrification. So I've started thinking about this, and I'm doing this in relation to the social harm perspective. This is my kind of big idea at the moment that I'm trying to work up. I think a shorthand for the social harm perspective, I think, is essentially, it's the social wreckage of neoliberalism and financialization. So I'm influenced here by the social harm perspective in criminology and the work of Hilliard, Pemberton Toms, people like that, to think about the harms that are caused directly or indirectly by housing to advance ideas about risk and inequality. I think using the social harm perspective to think about how homes are changing and how homes might change in the future is a way of broadening housing policy analysis by including this social harm lens. Home is a place where sorry, I'll say that again. I'm doing this in one take, by the way. That's my first mistake. My first big mistake. Home is a place where harm is often experienced and is of itself sometimes a source of harm. So I want to think about where home is a place where harms occur, and to reflect upon the fact that a safe and secure home is still far from many people's grasps. And this social harm perspective that we might bring to housing policy analysis will, I think, focus on the relationships between and within the spaces where physical, mental, social, moral, and material injuries or detriments occur. And that's what's happened, isn't it? That's what's happened since March throughout the world, but it's happened specifically in particular ways in Scotland. And I think that enabled us to reflect upon the fact that home is an important locus in a geography of harm, and that housing, I think, has been overlooked in the social harm literature. And that's my kind of big idea that I'd be willing to discuss with you and others and anyone who listen really in length later on. So that's my conclusion. These are reflections on work in progress and some remarks upon recent research, which I hope you found interesting. I think for me, it's been fascinating thinking about home in these very different ways. When I said I've been working on it for many years, and suddenly everybody else is interested in it too. So it's nice to have you to have a chat to. I'd welcome the opportunity to discuss this in more detail on Wednesday, when there's a kind of there's a plenary about this, to take advice, to take corrections or suggestions, or to simply send you my reading list if you want to read more details. Play along at home by tweeting the hashtags just there. You know what to do. Anyway, thanks for your time. I've enjoyed rambling on. I hope you've enjoyed listening, and I'll see you soon. Take care. Bye bye.